Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and here is what I bring to you all from the world of medicine. The effect of the early COVID-19 pandemic on cancer survivors. Recent research indicates that during the first year of the COVID-19 pandemic, the proportion of working-aged US adults without health insurance did not change despite increases in unemployment, and the prevalence of unhealthy behaviors decreased. The findings, which were published by Wiley Online in Cancer, pertain to individuals with and without a history of cancer. To investigate, Zhou Song Han and her colleagues used data from the nationwide population-based behavioral risk factor surveillance system, an annual household telephone survey, to examine changes in multiple health-related measures in 2020 among cancer survivors, comparing them with adults without a history of cancer. Specifically, they assessed health insurance coverage, access to care, employment, health behaviors, and self-reported health. Among adults aged 18 to 64 years, the uninsured rate did not change significantly in 2020 despite increases in unemployment. The prevalence of unhealthy behaviors such as insufficient sleep and smoking decreased in 2020, and self-rated health improved regardless of cancer history. Declines in smoking were more significant among cancer survivors than among adults without a cancer history. Our findings suggest that the pandemic may have motivated people to adopt certain healthier behaviors, and national and regional policy responses to the pandemic regarding insurance coverage, unemployment benefits, and financial assistance may have contributed to the observed positive changes, said Dr. Han. As policies related to the public health emergency expire, ongoing monitoring of longer-term effects of the COVID-19 pandemic on cancer survivorship is warranted, he added. The findings of how recovery progresses following inflammation triggered by injury or illness. Now, what differentiates a good inflammatory recovery from a bad one? A new study led by researchers at Harvard Medical School at Massachusetts General Hospital, published in Nature Communications, yields critical clues. The scientists identified universal features of the inflammatory responses of patients who successfully recovered after surgery or acute illnesses such as COVID-19, heart attack, and sepsis. These features they discovered included precise paths that white blood cell and platelet counts follow as they return to normal. Now, because inflammation occurs in patients who are already sick, it can be a complicated process to study. Thus, the researchers knew that to isolate common features, they would need to study inflammatory recovery in a highly controlled setting. We needed to find a situation where everybody starts off in the same generally stable state of health, and then they all get a similar inflammatory stimulus at a specific time, explained first author Brody Foy, a research fellow in systems biology at HMS and Mass General. To identify patterns of inflammatory recovery, the researchers examined medical record data from 4693 patients at Mass General who underwent cardiovascular surgery. After analyzing dozens of measurements simultaneously, they found common features in the trajectories of patients who recovered well. They homed in on two variables that reliably identified trajectories for successful inflammatory recovery: white blood cell count, which not surprisingly becomes elevated during inflammation, and platelet count, which decreases as platelets are used up for clotting and healing. Among the patients who recovered well after surgery, white blood cell count decreased at a precise rate, while platelet count increased at a different but also precise rate. These trajectories, the researchers said, can be used to monitor recovery in a personalized way. About the link between dental biorhythm and adolescent weight gain. An international research team led by Dr. Patrick Mahoney at Kent School of Anthropology and Conservation discovered the biorhythm in primary milk molars, Retzius periodicity RP, is related to aspects of physical development during early adolescence. A faster dental biorhythm produced smaller gains in weight and mass. The first of its kind research published by Nature Communications Medicine found that adolescents with a faster biorhythm, 5 or 6 day cycle, weighed less, gained the least weight, and had the smallest change in their body mass index over a 14-month period compared to those with a slower biorhythm. Those with a slow biorhythm, 7 or 8 day cycle, produced the greatest weight gain. Dental histologists have known about the biological rhythm for over 100 years, but its significance for body mass and growth emerged recently in studies that compare mammalian species. Research has now focused on the meaning of the rhythm for humans. One surprising finding was that participants with slower biorhythms were 6 times more likely to have a very high body mass index. Rapid change in body size is a natural consequence of adolescence, but excessive weight gain during puberty can have vast consequences for health, such as obesity in adulthood. close link between cases of COVID-19 and viral loads in wastewater. In this study, the authors wanted to examine the association between clinically reported cases and viral loads in wastewater. They correlated the results of 360 samples collected from manholes in 7 distinct areas of the village with confirmed COVID-19 cases obtained from the organizing committee and with data of close contact tests from a previous report. The researchers found that SARS-CoV-2 was present in 151 wastewater samples, 53 from the Olympics and 98 from the Paralympics. The number of confirmed cases were also higher in the Paralympics. The strongest correlation between SARS-CoV-2 RNA load in wastewater and the presence of clinical positive areas was found in areas that had maximum viral loads in wastewater in a 3-day span. The study suggests that WBE and clinical tests are complementary and that the testing strategy played a role in preventing COVID-19 clusters in the village. The study of one of the world's largest mass gatherings provides novel evidence on the implementation and use of wastewater-based epidemiology or WBE in communities where all members undergo daily testing and could be used to trace and control COVID-19 clusters in the future. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.